The changing roles of community health workers. According to the American Public Health Association, a community health worker is a frontline public health worker who is a trusted member of or has an unusually close understanding of the community served. Globally, there are many names for health workers, including Mother Worker in Ethiopia and Anganwadi in India. The purpose of community health workers are to improve access to healthcare, particularly in rural or hard-to-reach areas, to increase the affordability in poorer communities where the alternative may be no access at all, to make improvements in primary care, specifically in the case of vaccine uptake and mother and infant health, and to bridge the gap between the community and formal healthcare system where there may be a lack of trust or understanding. There's a documented 50-year history regarding the presence of community health workers. This concept originated in China as Chinese barefoot doctors. A number of other countries followed suit, partly in response to the successes of this movement and partly in response to the inability of conventional allopathic health services to deliver basic healthcare. In Indonesia during the 1980s, there was a reformation of their healthcare system with a focus on district healthcare. Their goals focused on family planning, health education, growth monitoring, nutritional support, immunization and treatment, particularly of diarrheal diseases. Results were significant, with infant mortality dropping by 30% and immunization coverage increasing manyfold. Of the 86 articles reviewed by the WHO on community health workers in developing countries, 19 of the studies focused on the cost effectiveness of community-based TB care compared to other strategies. The cost to the health service and patient was shown to be reduced by using community-based, directly observed therapy of antibiotics in many of these studies. One of the new challenges that caused the need for the shift in the role of these workers. Due to the huge increase in migration of people due to transport, job opportunities, and even war, community health workers are a key link to ensure that healthcare is available to everyone regardless of any cultural barriers. The rising prevalence of chronic inflammatory diseases, mental health diseases, and antibiotic resistance are causing an increased need for specialization of community health workers. The ever-rising populations directly require an increase in health workers while also requiring more opportunities, for example, family planning at a local, accessible level. Let's talk now about how these changing needs have a direct effect on the roles of community health workers here in Ireland. In the HSE, many new campaigns have been launched to target and deal with contemporary Ireland's new problems. The Healthy Ireland Compass campaign was launched by Cork Kerry Community Healthcare this year, dedicated to improving the well-being of the communities and healthcare staff, focusing on decreasing the prevalence of chronic diseases via initiatives such as exercise interventions for staff and encouraging patients to take control of their own diseases. Safe Talk is a training day launched by the HSE. The Safe Talk leaflet states that Safe Talk is a half-day training program that prepares you to identify people with thoughts of suicide and connect them to suicide first aid resources. Most people with thoughts of suicide don't truly want to die but are struggling with the pain in their lives. Through their words and actions, they invite help to stay alive. Those wishing to attend, contact their local health officer.
For the last few minutes, we're going to keep the focus on community health workers in Ireland. When we began researching the changing role of an Irish community health worker, we decided that the best way to explore this was to speak to a community health worker themselves. So, we interviewed a woman named Kathy, who has been a community health worker for the last 15 years, to learn about some of the ways in which her role has changed. Their workload has undoubtedly increased. They used to work with both adults and children simultaneously. Now, due to the increasing workload associated with each, they work with either adults or children and swap every couple of years to maintain their skills. They used to be generalists, performing a kitchen sink type job, but with an increasing caseload, they can now only tend to strict nursing needs. They used to make surveillance calls to check on patients that no longer had nursing needs. Now, these kinds of patients must be discharged from the database. There is a distinct lack of community health workers. During the recession, there was a freeze on hiring, and they are still feeling the effects of these losses. Globally, we mentioned that a rise in populations will require a coupled rise in community health workers. This remains the same in Ireland. The ratio of patients is so high that community health workers do not have the time to get to know their patients in the community the way that they once did, and cannot as easily recognise a patient's needs outside of their essential nursing requirements due to the lack of time spent with them. As we know, in the healthcare system there is a huge lack of resources. Due to a lack of beds, patients leave hospitals sooner and so sicker, making the community health workers' role more difficult. Twilight nurses used to make calls at night, filling the gap after 5 p.m. when community health workers leave. Due to a lack of funding, these no longer exist. Changes in society have also changed the role of a community health worker. Globally, we mentioned changes in disease trends and how they can impact the role of the community health worker. Generally, people are living longer, and so, in Ireland, community health workers are seeing many more complex diseases and cognitive impairment cases. Families are now working more, meaning a lack of a social network for isolated patients. As well as this, most people are not as close to their neighbours as they would have been in the past. The community health worker's role is now much more important, as they may be the only company an elderly or isolated patient has. To finish, there have also been some improvements when changing the role of the Irish community health worker. Once a week, community health workers now work in specialist clinics, like a leg ulcer clinic for example. This allows patients to be treated in the community, reducing the number of patients being referred to GPs and to hospitals. So, as we can see, in keeping with any healthcare related job, the role of community health worker both in Ireland and across the globe is ever changing and ever evolving.